Hi, Professor Lukoski. Again, my name is Riza, and then I'm in your adult health one class, unit term two, section one. And then now, I want to demonstrate is the piggy bag line, IV line, and then I have my MAR right here, and then I'm checking the doctor's order, and I want to check the doctor's order and then verify the correct medication, the dose, or the route, and the frequency, and then everything else. So I will make sure that everything is right. Doctor's order is a Zosine, and then it has to be um, mixed up with 300 milliliter normal saline infusing for 4 hours, and then with 10 drops per milliliter. And then I'm checking my medicine, and then it is expiration date is June 1st, 2015. So this is still good. And then this is my MAR. And then I did my math. The medication order is 2 gram per milliliter, and then available is 4 gram per milliliter. And then after doing my math, it comes up with 0.5 milliliter. And then the drop factor is the 10 drop per milliliter times 300 milliliter of normal saline, and then divided by 4 hours and convert that hours to 60 minutes, and then everything go down to 13 drop per hour per minute for the IV. So now I'm checking everything I need. I have the medicine, I have the blunt injection, I have my needles, and then I have my tube, I have my IV, my alligator clamp, and then some of my disinfection, and I have my piggy bag line. All right, so I'm going into the patient's room, and then knock on the door. Hi, sir. My name. I introduce myself. My name is Riza. I'm going to be your nurse today, and then the doctor's ordered to put another piggy bag line on another IV on you, and then we have to mix it with the antibiotic Zosyn, and then I have to stop. I have to put it in your IV side. So I'm going to check the IV side, and then to see if there's any inflammation, anything wrong with it, or it seems like everything's fine. There's no inflammation, and there's no redness or anything. So I'm going to wash my hands and apply the clean gloves. Putting my gloves on. Put my gloves on. Gloves is on, and then okay, now what I'm gonna do is I'm gonna put the IV. I'm gonna document the IV, document the name of the patient, the date, the time that I'm giving, and then what kind of medicine that I mix it in it, and then and then the documentation, and I tape it behind the IV bag, and then the I'm going to clean the medications container. I'm scrubbing it, and this is clean. I'm gonna take the blunt needle, putting it in, and then zero point 0.5 air. I'm gonna stab it. I'm gonna flush the air, and then I'm going to take zero point 0.5 medicine in it. All right, taking it out, and then putting the blunt needle back in, and I'm gonna change it to the regular needle. Putting it in, and then this is ready to go. And then the blonde needle will go to the sharp container. I'm ready to go. Everything, I'm going to check everything. Medicine's done. And then now I'm going to mix the medicine in this IV bag. All right. It is in it. I'm mixing it with the scoop method. I'm closing the needle, and then I'm gonna throw it in the sharp container, and I'm gonna mix. I'm mixing the medicine. Medicine is mixed, and then I am going to, since I already have the things up there, so I'm going to grab this. This is still sterile. This is just coming from the bag, and the bag was closed. And then I already put I already taped the documentation on the tube, and then to for the other nurse to know the date, the name, and then the date, and then the time that I'm using this tube line. All right, so I'm taking the two lines, the end lines, to make sure this is still gonna be sterile. Make sure nothing's touching it. Getting this, I'm going to stab it. All right, this is trash. Stabbing it. All right, this is on, and I'll make sure this is clamped. This is clamped, and then I will put this up here. Make sure this is not gonna be all over the place. That's good. And then I'm going to clamp this. Start from the bottom. Clamp this. Make sure everything's right. Clamping everything.